Um, think about your skin for a second. It is, well, it's essentially a living canvas, you know?
Oh, absolutely. It records your entire life.
Right. It holds onto those tiny scars from like when you scraped your knee as a kid. It tracks your sun exposure from decades of summer vacations.
Stretch marks from growth spurts or pregnancies.
Exactly. And for millions of people, it broadcasts these really intense internal struggles through chronic conditions like eczema.
Yeah, it's a highly reactive record of literally everything you have ever been through.
But what if we could hit the reset button on that canvas?
I mean, we are getting incredibly close to doing exactly that. We're moving so far beyond the era of superficial lotions.
Lotions that just sit on the surface trying to cover things up.
Right, or temporarily lock in moisture. The medical field is now looking at how to fundamentally alter the way the skin behaves chemically and how it physically rebuilt itself from the inside out.
And that is exactly our mission for today's deep dive. Because, wow, we have a stack of sources today covering the absolute frontier of modern dermatology.
The advancements, especially over the last 24 months, are just staggering.
Yeah, so we're going to decode the American Academy of Dermatology's 2025 updates on eczema first, which are totally shifting the paradigm.
Completely.
Then we are going to look at the intense, almost like science fiction world of CO2 lasers,
Those are the machines that vaporize your skin to force it into a state of renewal.
which is wild. And finally, we'll explore this booming world of global medical tourism where people are literally crossing oceans in pursuit of a flawless canvas.
In a massive industry now.
It really is. But I want to start with the chemical side of things first, specifically eczema or atopic dermatitis.
Okay, yeah.
Because I was reading through the sources, and the American Academy of Dermatology, the AAD, they just published a 2025 focused update to their clinical guidelines for adults.
Right. Highly anticipated update.
And they are giving very strong recommendations for some completely new therapies. But before we even get to what those are, how does the AAD actually decide what makes the cut? Because, you know, we hear about these quote-unquote miracle skincare ingredients every single week.
Oh, sure. But the AAD, they rely on a framework called the GRADE approach.
The GRADE approach.
Yeah, it is essentially a brutal, highly rigorous scoring system. It doesn't just look at whether a drug works.
Okay, what else is it looking at?
It assesses the absolute certainty of the clinical evidence. So they strip away all the marketing, all the hype, the isolated success stories on social media.
So they're just looking at hard data.
Exactly. So when the AAD issues a strong evidence-based recommendation for new treatments, it means the clinical data is undeniable.
Okay, let's unpack this because in this 2025 update, they recommended 4 new therapies that all just got FDA approval in 2024.
Right, the big 4.
Let me make sure I'm saying these right. Tapinarof, roflumilast, lebrikizumab, and nemolizumab.
You nailed it. Heavy medical names.
Very heavy. But, like, if you have chronic eczema, your skin is basically acting like a faulty, blaring fire alarm that never shuts off, right?
That's a great way to put it.
It's red, itchy, inflamed, just exhausting. So why do these 4 specific drugs actually matter? I mean, are they just slightly better moisturizers?
No, they're completely different from a moisturizer.
Yeah.
To really understand why they matter, you have to look at the mechanics of that fire alarm you just mentioned.
Okay.
Eczema is a profound dysfunction of the skin barrier, but it's combined with a hyperactive immune response.
Right. The immune system is panicking.
Yes, and when it senses a threat, it releases these tiny chemical messengers called cytokines.
Cytokines. Okay.
Picture these cytokines as the actual sound waves of the fire alarm. They are screaming at your skin to become inflamed.
Wow. So the skin is constantly under a state of chemical attack from its own immune system.
Exactly. And what these new therapies do, whether we're talking about the topical creams like Tapinarof and roflumilast or the systemic treatments, is they hunt down those specific cytokines.
They hunt them down.
They do. They don't just sit on the skin to soothe it. They bind to the specific molecular pathways and literally silence the alarm.
Oh.
They interrupt the inflammatory cycle at the cellular level.
Okay, but if they're shutting down the alarm itself, does that mean the relief actually lasts?
Well, that's the big question.
Because anyone who uses, like, standard steroid creams knows the second you stop using them, the redness and the itching just roar right back.
Right. The rebound effect.
Okay.
But the data on longevity is what makes these new guidelines so critical. Let's look at the manufacturer data for Tapinarof, which goes by the brand name VTAMA.
Okay, VTAMA.
They ran this massive long-term follow-up study tracking patients over 48 weeks. And they wanted to see what happened after a patient achieved treatment success.
Meaning their skin was, like, totally clear?
Totally clear or almost clear. They wanted to see what happened when they stopped applying the cream entirely.
Wait, they just cut them off the medication to see how long it took for the fire to start again?
Yes, they just waited. And the average treatment-free interval lasted 80 days.
Wait, almost 3 months without needing to apply any.
80 days, yeah.
That is practically a cure.
Well, I mean, it is not a cure
Yep.
because the underlying genetic predisposition is still there.
Sure.
But it means the fire is put out so thoroughly that the embers take an average of 80 days to reignite.
That's insane.
For a patient who has spent their entire life waking up to cracked, bleeding skin, 80 days of total silence is revolutionary. It completely
Yeah.
changes their psychological relationship with their own body.
I can't even imagine. Okay, so fixing that chemical barrier and stopping the inflammation is an incredible first step. But what happens when the damage isn't a chemical fire?
You mean structural damage?
Yeah, what about the physical architecture of the skin? Because if you have deep pitted acne scars from when you were a teenager, or like entrenched stretch marks, a cream that stops inflammation isn't going to fill in a physical crater.
No, it won't. That requires moving to something much more aggressive.
Right.
This is where we enter the realm of energy-based skin resurfacing. This is where dermatologists are actively, physically altering the dermal architecture of the skin to force it to rebuild.
And the sources highlight two heavyweights in this space, right? Fractional CO2 lasers and RF or radiofrequency microneedling.
Correct, the big two.
And the mechanics of the CO2 laser are just wild to me. The sources refer to it as an ablative laser, operating at a wavelength of 10,600 nanometers.
Yes, 10,600.
But what does that actually mean? Like, what is that specific wavelength doing to your face?
So that 10,600 nanometer wavelength has a very specific target, and that target is water.
Just normal water.
Right. Human skin cells are primarily composed of water. When the CO2 laser hits the skin, the water inside those cells absorbs the energy and instantaneously boils.
Wait, it boils.
Yes, the tissue is literally vaporized in a fraction of a second, leaving these microscopic columns of empty space in the skin.
Here's where it gets really interesting, because I always picture the fractional CO2 laser, like lawn aeration.
Lawn aeration. Yeah.
Like, if you have a struggling, patchy lawn, you hire someone to come punch thousands of tiny holes into the dirt, right?
Right, they pull out the plugs.
Exactly. It looks terrible at first, but by removing those plugs of dense dirt, the whole lawn is forced to grow back thicker, greener, and healthier. So the laser is essentially just aerating your face.
That is a perfect way to visualize it, honestly. The body registers those vaporized columns as a severe emergency.
A crisis.
Right, so it floods the area with fresh collagen and elastin, which are the building blocks of healthy skin, to fill in the holes.
Wow.
And the fractional aspect is really key here. Older, fully ablative lasers used to just burn off the entire top layer of the skin.
Just take the whole thing off. That sounds awful.
It was intense. But fractional technology leaves tiny bridges of untouched, healthy skin between the vaporized holes. And those healthy bridges act as repair bases, which drastically speeds up the healing time.
Okay, but if you are listening to this right now and thinking, does having the water in my skin cells instantaneously boiled hurt?
The answer is yes.
Yeah, the answer is a very strong yes, which is why they use heavy numbing creams or even local anesthesia for this.
Absolutely required.
And the downtime is intense. The sources say you are looking at like 3 to 5 days of redness, swelling, and crusting.
It's not pretty.
But then you compare that to RF microneedling, which only requires 1 to 3 days of downtime.
Much faster recovery.
Right, because with RF microneedling, physical needles punch into the skin and then release heat deep down, rather than vaporizing the surface. So if CO2 is so aggressive and requires so much more recovery, why wouldn't a doctor just use RF microneedling for everything?
This raises an important question, and it really comes down to the density of the scar tissue we are trying to repair.
Okay, how so?
RF microneedling is excellent for overall skin tightening and mild texture issues, but CO2 remains the undisputed gold standard for severe, sharp depressions.
Like those deep acne scars.
Exactly. Take boxcar acne scars. Those are the scars with steep, clearly defined edges. Or look at how the sources categorize stretch marks.
Yeah, I noticed that. The sources divide stretch marks into two distinct camps. You have striae rubrae, which are the newer red or purple stretch marks.
Right, they still have active blood flow.
Yeah, the body is still trying to heal them. And then you have strialbe, which are the older, white, kind of silvery stretch marks.
And those white stretch marks, the strialbe, are essentially static, entrenched scar tissue.
They're locked in.
Completely. The blood vessels have retreated, and the collagen fibers are completely disorganized and hardened. RF microneedling often just cannot generate enough thermal destruction to break up that hardened matrix.
Oh, just not strong enough.
Right. Because older stretch marks have so little active tissue, they need the intense, vaporizing thermal columns of a CO2 laser to physically blast apart that static scar tissue.
Does it make them disappear completely?
No, it won't erase them entirely, nothing will. But the clinical data shows CO2 can blend them into the surrounding skin by about 50 to 70%.
Which is a massive visual difference.
Oh, huge.
But there is a serious variable in all this heat generation, because this whole lawn aeration approach relies entirely on intense thermal destruction. And according to the sources, the amount of melanin in a patient's skin completely alters the safety of this procedure.
Melanin content is the single most critical variable a practitioner has to manage.
Really?
Oh, yeah. In dermatology, we classify skin using the Fitzpatrick scale. It ranges from type I, which is very fair skin that always burns in the sun, to type 6, which is a deeply pigmented, melanin-rich skin.
Think of melanin reacting to a laser, like wearing a t-shirt on a blazing hot sunny day.
Okay.
If you wear a white t-shirt, it reflects the sunlight and your body stays relatively cool.
Right.
But if you wear a black t-shirt, the fabric absorbs all that light and converts it into heat, and you get very hot very fast. Melanin works the same way with laser energy, doesn't it?
That's a fantastic analogy. The more melanin in the skin, the more laser energy it absorbs and traps as heat.
And what happens to that trapped heat?
Well, it triggers a defense mechanism. It can lead to post-inflammatory hyperpigmentation, or PIH, which is a severe, sometimes permanent darkening of the skin caused by the trauma of the heat.
Permanent darkening. Wow.
Yes. Alternatively, the heat can completely destroy the melanocytes, which are the cells that actually produce pigment, resulting in hypopigmentation, which leaves permanent white patches.
So because the CO2 laser generates so much heat right on the surface of the skin, Fitzpatrick skin types 5E through Z are at a significantly higher risk for these complications.
Extremely high risk, yes.
So wait, are people with darker skin tones just entirely locked out of these skin resurfacing results? Like, do they just have to accept their scars because the lasers are too dangerous?
Well, what's fascinating here is that modern dermatology has engineered highly specific workarounds. They're not locked out at all anymore.
How does that work?
Practitioners will often pivot from ablative lasers, like the CO2, to non-ablative lasers, such as the Erbium 1550 nanometer or the anti-Ig lasers mentioned in the sources.
Okay, but how do those bypass the heat problem?
It's basically physics. An ablative laser vaporizes the top layer of the skin, the epidermis, where a lot of the melanin resides. Non-ablative lasers operate at wavelengths that completely bypass the surface layer. They pass right through the epidermis without damaging it and deposit their heat directly into the deeper layer, the dermis.
Oh, that is so clever.
It is. And RF microneedling uses a mechanical version of this exact same trick. The physical needles push past the surface pigment, and the heat is only emitted from the very tip of the needle, deep underground.
The sources actually detail this really interesting clinical trial at Cairo University that put this to the test on darker skin tones.
The ultrasound study, right?
Yeah, they tested a short-pulsed NGYAG laser against the fractional CO2 laser, specifically on those stubborn white stretch marks. And I love how they measured the results.
They were incredibly precise.
They didn't just take before and after photos and say, yeah, it looks better. They use high-frequency skin ultrasound to literally measure the thickness of the dermis.
And that objective measurement is what separates medical science from cosmetic marketing. A treatment might cause superficial swelling that makes a scar look better for a few weeks. But the ultrasound proved that these targeted, non-ablative lasers were actually forcing the body to lay down thick, permanent new bands of collagen.
And doing it safely.
Entirely safely in melanin-rich skin. However, I should note, achieving those safe results requires meticulous preparation.
What kind of prep?
Patients with darker skin tones often spend weeks prepping with brightening serums to essentially calm down their pigment-producing cells before the laser even touches them.
Got it. Okay, but that level of precision bypassing specific layers of skin with exact wavelengths, it requires some serious hardware, which brings up the absolute elephant in the room.
The cost.
The cost. One of our sources, a clinic in the UK, noted that a single high-end CO2 laser machine can cost a clinic up to £55,000.
They are massive investments.
And to recoup that cost, a patient walking in for a full-face CO2 treatment is looking at paying anywhere from £1,000 to £4,000.
Right. And remember, these procedures are entirely elective. They are not covered by insurance.
Zero insurance coverage.
Exactly.
Yeah.
So when you have a highly effective technology that requires a massive financial investment from the patient, you create the perfect conditions for a secondary market to just explode.
Which brings us to the global medical tourism industry. The statistics in these sources are just
See,
staggering.
it's booming.
We just said a full-face treatment in the UK can hit £4,000. But if you fly to Turkey, clinics are offering packages starting at $472.
Incredible difference.
In South Korea, it starts from $850. Mexico is around $1,200. You have specific neighborhoods like the Gangnam and Cheongdam districts in Seoul, where individual clinics are seeing 25,000 patients annually.
Volumes that are just unheard of in the West.
And they are even pairing the lasers with something called regenerative exosomes to speed up healing. Wait, what are exosomes?
Exosomes are fascinating. They're essentially microscopic delivery vehicles secreted by stem cells.
Delivery vehicles.
Yeah, think of them as little biological bubbles packed with growth factors, proteins, and genetic signaling information. When applied to freshly lasered skin, remember those vaporized columns we talked about?
Oh.
The exosomes dive straight into the deep tissue and act like an elite repair crew.
Oh, wow.
They massively accelerate the skin's natural healing response and reduce inflammation.
So people are going overseas and getting top-tier lasers paired with cutting-edge stem cell tech for a fraction of the cost.
They are.
So what does this all mean? I have to ask, if a clinic in Turkey or South Korea is doing a procedure for $500 that costs thousands in London or New York, isn't that a massive red flag?
Yeah.
Are they cutting corners on safety or using cheap knockoff machines?
If we connect this to the bigger picture, you might assume that, but the data points to the economics of scale.
Economies of scale, really.
Yes, a clinic in Seoul seeing 25,000 patients a year has its overhead spread incredibly thin.
Yeah.
They can afford to buy those 55,000-pound machines because they are running them nonstop every single day.
Oh, I see. They're just doing it so much.
Exactly. Furthermore, the doctors in these hubs are highly specialized. They aren't treating rashes one minute and doing lasers the next.
Right.
They're performing the exact same CO2 laser procedure thousands of times a year. That sheer volume of repetition breeds extreme technical competence.
Okay, but there has to be a catch. You don't just get a flawless canvas and a cheap vacation without a trade-off.
The trade-off is the recovery reality. Medical tourism is heavily marketed as a quote-unquote medical holiday.
Yeah, like you go get a laser and then sit by the pool.
But think back to our discussion on heat, trauma, and pigmentation. After a CO2 laser, your skin is essentially an open, oozing wound for the first few days.
Right, the law narration.
Yes.
Yeah.
And once it heals over, that brand new skin is incredibly vulnerable. Patients are strictly advised to stay completely out of the sun for at least 14 days.
Which completely ruins the idea of a vacation.
Exactly. If you walk out into the bright sun of a Turkish beach resort or spend the afternoon sightseeing in Seoul with raw post-laser skin, you are risking severe permanent hyperpigmentation.
So your holidays.
Your holiday actually involves being confined to a hotel room with the curtains drawn, applying thick ointments to a swollen, peeling face for a week.
It's a vampire holiday.
A vampire holiday, exactly.
You might save thousands of dollars, but you are trading it for a very intense, very isolated recovery process in a foreign country.
And if something goes wrong, if you develop an infection or a pigmentation issue after you fly home, the doctor who treated you is 5,000 miles away.
Wow, so that geographic distance is the true hidden cost of the medical tourism boom.
It really is.
Well, we have covered some truly groundbreaking territory today. We started with the invisible chemical battles happening on the skin, the AAD's 2025 updates, and the new therapies that can hunt down cytokines, silence the fire alarm of eczema, and grant patients an average of 80 days of total peace.
Which is life-changing. And then we moved into the physical architecture, exploring how the microscopic law narration of fractional lasers can vaporize static scar tissue, forcing the body to rebuild deep stretch marks and acne scars from the ground up.
We looked at the critical importance of the Fitzpatrick scale and how adjusting wavelengths can safely bypass melanin to bring these amazing results to all skin tones. Safely. And finally, we unpacked the volume-driven economics of medical tourism, where resetting your canvas is just a budget plane ticket away.
It's a brave new world for dermatology.
It really is, and it leaves you with a profound question to chew on. As this technology continues to advance, as it becomes cheaper, faster, and more globally accessible, how will our psychological relationship with our own reflections change?
It's a fascinating thought.
Right. When our physical scars, our deep wrinkles, and the visual signs of a life well lived become entirely optional, What will it actually mean to age gracefully? If the canvas can always be wiped clean, how do we decide which marks are worth keeping? Thank you for joining us for this deep dive. We will catch you next time.